Clinical examination of the central nervous system. Testing for power in upper limbs. So you put the right hand on the anterior aspect of the humerus and you let the patient push the hand against resistance. So this is testing for flexion of the shoulder joint. And to test for extension of the shoulder joint, you put the right hand on the posterior aspect of the humerus and you let the patient push against it. To test adduction of the shoulder joint, you place the hand on the medial aspect of the humerus and you let the patient push against resistance. To test for abduction, that's abduction of the shoulder joint, you place the hand on the lateral aspect of the humerus and you let the patient push the hand against resistance. To test for flexion of the elbow, slightly flex the elbow joint and with the right hand on the anterior aspect of the forearm, you try to straighten the elbow joint or the patient flexes the elbow against resistance. To test for extension of the elbow, you flex the elbow joint and with the right hand on the posterior aspect of the forearm, you let the patient push the hand against resistance. So flexion and extension of the wrist is done with the patient's hand in a fisted position. And to test for flexion of the wrist joint, you place the right hand on the palmar aspect of the fisted hand and you let the patient push against the hand. And to test for extension of the wrist joint, you place the right hand on the dorsal aspect of the fisted hand and you let the patient push the hand against resistance. So it tests the power of the intrinsic muscles of the hand. The middle finger is taken as the midline and the movements of the fingers towards its adduction as adduction, and movements of the fingers away from its abduction as abduction. So you can place a piece of paper between the fingers and try to move the paper out while the patient is resisting it. The strength with which the patient prevents the paper from being pulled away from the fingers gives one idea about the strength of the intrinsic muscles of the hand. Movement of the thumb to the various fingers is described as opponents. So you can test for abduction and adduction of the thumb against resistance. You know the movements of the thumb as normally at right angles to movements of the fingers. Finally, you test for flexion and extension of the phalanges of the hands by letting the patient perform this movement against resistance. Always compare the power in the two upper limbs.